Raise your hand if you've ever been asked the question, what do you want to be when you grow up? Okay, so basically all of you. So usually you hear responses such as, I want to be a doctor, or a lawyer, or the CEO of my own company. But when I'm asked that question, I tell people that I want to be a drug dealer. Now, I know what you're probably thinking, but I'm not referring to the ones that you see in a back alley. I'm referring to the ones that you're going to see in the operating room. Hello everyone, my name is Emad OW, and the topic of study that I chose to pursue this year in an ISM is anesthesiology. So in the words of Martin Fisher, in the sick room, 10 cents worth of human understanding equals $10 worth of medical science. Ever since I was little, I had a passion for helping others. Just seeing the smile on someone's face after I've helped them is what motivates me to keep doing it whenever I get the chance. And sure, I can help people by doing favors and such, but I feel that I can truly help people as a doctor. If I'm able to save a patient's life and actually be a part of their recovery process, I feel like I can truly make a difference in someone else's life. This passion of mine is what inspired me to be in the ISM program. And as a result, I've been able to learn so much about the field of anesthesiology through my mentor, research, and my original work. What I've been able to learn through my research in ISM is that an anesthesiologist does much more than just administer anesthesia. While it's true that administering anesthesia is an important task for an anesthesiologist, it tends to be overlooked by the public since it's actually a very stressful task. When I interviewed Dr. Catherine Barden, she explained to me that during surgery it tends to get fairly stressful at times, so it's very crucial that the anesthesiologist administers the right amount of anesthetic. An overdose of anesthetic can cause nausea, vomiting, difficulty breathing, mental impairment, and as well as brain damage. Administering too little anesthesia can result in a very scary situation known as anesthetic awareness, where a patient can actually wake up in the middle of a surgery and essentially feel everything that a surgeon's doing to them, every little incision, everything. And so it's really crucial that the correct amount of anesthesia is delivered. As an anesthesiologist, it's most likely that one will face a situation where the success of the operation is dependent on them. And while it may be stressful, anesthesiologists undergo years of rigorous training in their field so they can be ready for almost any situation. My interview with Dr. Stephanie Byerly was interesting since it opened my mind to a field in anesthesiology that I had known little about. Dr. Byerly works on the labor and delivery floor at Clements Hospital, and although I was not particularly interested in labor and delivery, I was happy to conduct the interview anyway since I wanted to gain knowledge on the different specialties of anesthesiology. I was particularly interested on how she would administer anesthesia. And this was interesting to me because instead of actually putting the patient under in this type of situation, the anesthesiologist actually administers analgesia, which is in which its primary function is just to control and manage pain. And they still have to watch over vital signs and to make sure that the patient is not in danger, but their job in this case can actually be quite difficult since they're in charge of not just one patient, but actually two patients. And although I had not previously looked into labor and delivery, I had still found this field of anesthesiology really interesting. And something else I've learned since the beginning of my ISM journey is that there is fortunately a lot of patient contact in anesthesiology. When I went on an interview with Dr. Srikant Cheriku, who worked at UT Southwestern, I was able to find that anesthesiologists have a very important role when it comes to providing care for patients. Dr. Cheriku explained to me that anesthesiologists have to make a care plan for the patient before, during, and after surgery. This involves choosing the type of anesthetic, the best anesthetic for the procedure, how much of it will be administered, and as well as how to get the patient to regain consciousness or extubate the patient. Devising a care plan generally calls for more interaction with the patient, and that's one of the many reasons why I would like to be an anesthesiologist. I just really like the idea of actually being involved in the patient's care and their recovery after the procedure. And because I'm primarily focused on patient interaction in anesthesiology is the reason why I actually chose Dr. Srikant Cheriku as my mentor. During our interview, Dr. Chirku explained that his favorite part of being an anesthesiologist was allowing patients to spend more time with their families through effective treatment and care. And his statement and devotion to his work showed me that he genuinely cares about each and every patient that he sees. And he's someone that can really teach me what the field of anesthesiology is just really like, because he has about 16 years of experience, and what he does really consists of just so much. And lots of people think that an anesthesiologist's job is just to administer anesthesia and they can just do whatever they want for the rest of it. But that's not true, especially for him, because he's a cardiothoracic anesthesiologist, and because of that, he's constantly dealing with patients in a critical condition and in need of extensive care. Sorry. Because of this, I was able to see how I want to see how he's able to handle patients in many different conditions, and how he creates a care plan for all of them to essentially save their lives and get each patient back with their families. When I went on my first mentor visit, I immediately got to talking with him about potential areas to research, and he helped me decide what to do for my original work. For my original work, I had originally decided to create a list that consisted of all the different types of anesthesia that are administered to patients. And this list would consist of the type of anesthesia, the side effects, and overall allow patients to choose what type of anesthesia they preferred. And I discussed this with my mentor, Dr. Srikant Cheriku, and he explained to me that while my proposal was very considerate, it was very unlikely that patients get a choice for anesthesia in most procedures. It's usually decided on by a panel of anesthesiologists already, and they obviously know more than the patient themselves, so it's very unlikely that the patients themselves would get a say in what anesthetic that they're administered. And however, because I did want my original work to allow patients to have some choice, he understood my thought process in that sense, and he explained to me that the main complaint that patients have in their anesthesia care is that sometimes they're not informed of all their choices. And he explained to me that the different procedures of where having a choice in anesthesia is actually possible. He explained to me that during some childbirth procedures, when women are undergoing labor, they're excuse me, they're allowed to choose between epidural or general anesthesia. In epidural anesthesia, the mother is conscious during childbirth and is essentially numb so that she doesn't feel pain. While in general anesthesia, the mother is unconscious and is unaware of what is going on during the procedure. The fact is that both anesthesia types have benefits and drawbacks, yet some patients are not informed that they have this choice at all. So Dr. Chiruka and I began to discuss spinal versus general anesthesia in orthopedic surgery. He explained to me that in recent years, spinal anesthesia has begun to be favored more than general anesthesia due to the lack of complications, such as risk of stroke and heart attack, and yet the majority of hospitals still administer general anesthesia. I realized that if I chose to research the differences between epidural, spinal and general anesthesia in orthopedic surgery, I have the potential to inform doctors and patients of the differences in outcomes of general and spinal anesthesia by evaluating different studies and comparing their outcomes. And in order for me to research the differences, Dr. Cheriku sent me different articles from a medical database that actually tests epidural and general anesthesia in a total hip arthroplasty and compares their outcomes in patients. From my research, I found that based off the studies, it was concluded that when compared with general anesthesia, spinal anesthesia for total hip arthroplasties had shorter operative, postoperative recovery room time. Significantly, the study also found that the use of spinal anesthesia resulted in fewer cases of cardiac arrest, stroke, and unplanned intubation, with odds ratios of 5.04, 2.51, and 2.17 respectively. And while this may seem minuscule to some, it's actually a really significant number, because the fact that so many people are getting, the risk is so decreased just from the use of spinal anesthesia it really goes to show that maybe through the switch to spinal anesthesia, this risk can be decreased by an enormous degree, and lots more lives can be saved through that. And also, the use of spinal anesthesia also allowed for less post-operative ventilator use and a less need for blood transfusions, which is even better. And that had ratios of 5.81 and 1.34 respectively. And the results obtained in the study performed by the Yale University School of Medicine reflect that patients who received spinal anesthesia had better outcomes, which was also supported by the data when spinal anesthesia was revealed to have lower adverse events than general anesthesia. This goes to show that epidural anesthesia does have better outcomes than general anesthesia and could allow for a decrease in risk for patients undergoing a total hip arthroplasty. So while my original work was different from my first proposal, it did have the same philosophy of informing doctors and patients. My research paper can really show people differences among general and spinal anesthesia. It shows that, based off of the studies, spinal anesthesia is potentially better for patients and can in fact create less adverse events for patients undergoing orthopedic procedures. The main objective of my research paper was to allow patients to have enough knowledge to choose what type of anesthesia will be best for them. And overall, just from these past months in ISM, I felt that I was able to just learn so much from my mentor, research, and original work. The knowledge I've gained alone has provided me with so much insight on my future and what I must do to achieve my goals. I was able to determine that anesthesiologists have a very crucial role in operations and that they actually save lives every day. And this whole experience kind of shows me how some drug dealers can actually make a difference in the world. Thank you.